Hey guys, this is Dr. Sandy with another video and health tip on how you can have the highest quality of life possible. We are going to be talking about headaches and migraines and natural things we can do to improve that situation. Now, why is this a serious situation? I've been in practice now for over 20 years, and I can tell you that when I've met people suffering with headaches and migraines, it can be very debilitating. It definitely affects quality of life. It can affect their work performance. It can affect school performance. It can affect their personal life, going out with their friends. It affects so many things, and it's something that can be very frustrating to say the least. So the goal of this video is giving you ways to look at it, analyze, and just ask yourself, what am I doing that may be causing it? What can I change in my lifestyle? What are things I can even do just to help that situation naturally? Because again, headaches and migraines can be very debilitating to say the least. Now, let's talk about. I'm using the terms headaches and migraines kind of interchangeably because to me, I feel like it's kind of a spectrum. So headaches would be obviously the milder form. You feel that pressure, you can still kind of manage, you get through your day, you rest a bit, you seem to manage. But what migraines in my spectrum would be the other extreme. I mean, now you're talking about someone who's like probably can't go to work, maybe needs a few days off, probably light, sound, very sensitive. Those things can be irritating. So they may want to go in a dark room, not want to interact or talk to anyone. If it gets bad enough, they may vomit, they may feel dizzy. It's a very extreme case. So I'm using those terms because to me, a migraine is a very, very extreme form of a headache. And then you get into like tension headaches, cluster headaches, all these different types of things. I'm going to step back from all these names and kind of say, okay, what we can agree on is there's something going on here that doesn't feel right. There's different categories and names, but is there something we can just do just to help this whole area? Let's sit back, and regardless if it is a migraine, if it is a cluster headache, a tension headache, or just a regular headache, what are things we can do? Are there principles? Are there concepts we can use just to help this area? So number one, I'm going to be talking about the power system and looking through that lens. And the first thing we would talk about is power focus. And what is power focus? If you know, in our office, we talk about this. So we always talk about making time for yourself, whether that's prayer, meditation, deep breathing, whatever works for you, or if that's journaling. But you need to make time for yourself. And in this context, what I'm going to say is that have you been working too hard? Have you had too many late nights? And I understand once in a while we all get late nights, but if it's a habit, that lack of sleep, are you working 5 days a week, 6 days a week, or 7 days a week? And I know everyone has these different rhythms, but if you're not getting the sleep, if you're constantly working, if you haven't had a vacation in a long time or some kind of break or even just a staycation, staying home, it can catch up to you. You have to look at your lifestyle. And maybe with your workload, you need to say, hey, do I need to build a team? Do I need to delegate more? Do I need to talk to my boss or my supervisor about solutions? You want to look at that. So I really look at your lifestyle. That's would be power focus. Number two would be power food. So you want to eat the healthiest foods, but in this context, my question to you is that are you drinking enough water and are you having those healthy foods? So imagine the situation. So you have someone who's working a lot, eating a lot of fast food or ordering food to their house, um, drinking a lot of maybe sodas and pops, not drinking enough water, drinking high sugar content drinks, maybe having alcohol as well. So a poor diet, poor lifestyle, poor nutrition, skipping meals, not a good idea. Obviously, that can cause stress to the system as well. So you start to say, okay, so I'm looking at this, someone who might be working long hours, lack of sleep, lots of caffeinated beverages, the coffees, the teas, the soda pop, whatever that looks like, alcohol, then maybe they're smoking. You start to see all these things. This will affect this situation. This will contribute to things like the headaches, the migraines, feeling the discomfort in the head. So that would be power food. So the next category you want to jump into is looking at your movement level. So what we recommend obviously is that you should be moving, you should be exercising. If you're sitting all day in front of a computer, like I'd say probably most North Americans now work in front of a computer at least part of their day. What happens is the human body was designed to move, and when you're not moving and you're sitting there for 2 hours, 4 hours, 6 hours, 8 hours in front of your computer, you're not moving enough. It's going to cause the spine, the muscles, the nerves, everything to kind of lock up. And if you do this for a week, weeks, month, years, you just keep doing this, and over a decade or something, you're going to have issues start to develop. So you want to get up every hour and stretch. Maybe if you're working from home with a laptop, work in different parts of the house, kind of mix it up. A big tip I tell my patients as well, as much as you can throughout your day, you want to be standing. Some really easy stretches would be practicing going into extension, having the head go back, going from side to side, listening to your body, of course, tilting the head side to side, listening to your body. I got to tell you this. I know a lot of people talk about doing like that full revolution. I find that quite demanding and hard on the body. So I'll leave that one up to you. My recommendation, I like linear movements. So I would recommend extension. You don't want to practice this because you're probably on a computer anyhow. We want to practice extension. We want to practice going backwards. We want this kind of movement. We want that rotation. And I really love doing the lateral movement. So, tell yourself every hour you're getting up to do that. You're bending from side to side every hour, just doing some stretches. Another one I would really recommend is through a doorway. You're putting your hands, you're pushing through. That'll help take pressure off this area. It really helps with posture correction. And if you want, you can go like this and have the head go back, which would be even better. So that would be on the physical side. And what else we can do as a positive way, get some fresh air, go for a walk even in your backyard, in your house, get that body moving. We know exercise is a good thing. You need to move, you need to stretch, maybe look at doing yoga. There's a lot of options there. And again, obviously listen to your body, see what you can handle. But if you're moving, it will be a positive and it will actually help with headaches, migraines, and things of that nature. And then the last one would obviously be if you're having issues as well, this needs to be assessed by a chiropractor. And in chiropractic, what we're going to look for, how is the alignment? You'd probably go through you would go through an assessment, and what we're going to be looking for is the alignment there of the spine, or has there been a shift? And when I said probably, what I meant is a lot of times with people who have headaches and migraines, if there's been a shift of that spine causing a misalignment, in a lot of cases, the nerves are getting compressed. That can cause inflammation response. It can cause numbness. It can cause tingling. It can go into the eyes, ears, nose, throat, anywhere in the face. It can go in the back of the head. So it's something that needs to be assessed, something that has to be taken care of. And then you can work with your chiropractor. You can actually have this, if we find there is a problem, getting that back on track, getting that gently, scientifically back on track, getting it aligned, and then talking to your chiro and saying, hey, you know what? How do we maintain this? And then that's an option you would have where you can talk to your chiropractor and say, hey, now that I feel good, what can I do to maintain it? And the question becomes, why would you even need to maintain it? You should have a good diet. You need to exercise. You need to do your stretches. You need to do all those things. But because people get back on a computer, because people may not have the best diet, because there might be some nights where you don't get enough rest, because people get stressed, the biggest cause, one of the biggest contributors of headaches and migraines, even if there's other health issues, is stress. It's the biggest one. So just like going to a dentist to maintain the teeth, once you're starting to feel better, the option you have is to maintain that. And then the cool thing is with maintenance, it's definitely not as frequent. The visits are more spaced out. And now you're just saying, I just want to keep this healthy. I want to keep it strong. And in a lot of cases, what can happen is the headaches and migraines can be reduced, in some cases even eliminated. And even if they come back, you'll find that the intensity is not as strong, the frequency is not as often, and it's something you can work on by aligning the spine, having this properly taken care of by the chiropractor with a healthy diet, with that healthy lifestyle, with exercise. You're just doing all these things constantly and just making the body as strong as possible. And also realize, and I would say this too, if a patient comes to me and they've been suffering for 2-3 months versus 3-4 years versus 3-4 decades, those are completely different cases. You have to look at their lifestyle. How long have they been suffering? What is the severity? Every case is a little different, but what I believe is if we're doing enough of the positive, right things, it can only help the situation. So before I do finish, I would say one thing. If you are listening to this and you are having discomfort and you're kind of like, I see what you're saying about lifestyle changes, drinking water would obviously be a huge one as well, but what are some tips right away that I can do if you're watching this video and you have discomfort? One thing I would recommend is you can get a cold, wet towel, and you can put it on the neck. You can put it on the area you have discomfort. I probably do 5-10 minutes, and you can try doing that 3-4 times a day. If you put it on that area with a cold, wet towel and you feel any discomfort, obviously you want to stop. But for a lot of people, that just gives you some relief. I think another thing I would recommend is if you want, you can just gently massage the shoulders, whatever you can tolerate. If there's a family member, gently, if they can just massage this area. You got to be careful over here. So I would recommend on the shoulders, getting a gentle massage, or you can even do a self massage, doing the stretches, drinking water. And taking time to do some deep breathing exercises. Deep breathing slows down the system, it relaxes the system. Making time for that can be very, very powerful. So I mentioned quite a few things in this video, so please implement those things. And I would even say if you're listening to this and you're like, well, actually, I feel good and I never get headaches and migraines, there's nothing wrong with still just being proactive and saying, you know what, I'll take care of the spine. I'm going to have a good diet. I'm still going to have exercise because I never want that to happen to me. Be proactive, keep your spine healthy and strong so you can have the best life possible. So guys, I hope you love this video. If you're enjoying them, please like, share, subscribe. Really appreciate the time you've taken to listen to this. God bless you, and I'll see you again here for another health tip. God bless.